Welcome back to Rural Health News, the segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? A recent letter from the Congressional Budget Office outlines the effects that the One Big Beautiful Bill will have on Medicare under the statutory Pay-As-You-Go Act of 2010. This act requires Congress to keep new legislative budget neutral, meaning it cannot increase on-budget deficits without 4 fiscal years. Now, when legislation increases the deficit, the Pay-Go Act requires sequestration to offset the cost. Ultimately, this means that Medicare program will be deeply cut to make up for the $5.6 trillion in federal deficit increase caused by the big One Beautiful Bill. The resulting sequestration will likely cost Medicare $491 billion. Folks, that's a B, billion, between 2027 and 2034. Some programs are exempt from sequestration, including Social Security, leaving the Medicare budget immediately at risk. Now on to the damage report. In the past episodes, we've discussed legislation and policies that directly damage the efficiency and emergency rooms across this country. Now, with Medicaid cuts threatening to shut down preventative care in most rural communities, let's take a look at how emergency rooms will be impacted. The most obvious effect is the traffic. When resources are drained, preventative care can't operate and chronic disease management cases cease to exist. Those would be clinic patient end up in the emergency departments and either using it as a primary care or waiting until their health concerns or emergent needs that are due to the lack of medical attention. According to some lawmakers, the cuts to Medicaid will eliminate coverage for illegal aliens that are making up a significant portion of the program's beneficiaries. But we know from the data that these claims are grossly exaggerated. Even if a concerning number of non-citizens were managing to access insurance coverage through programs like Medicaid, cutting those individuals off the coverage would push them into our emergency rooms across the country, where hospitals are required by law, called EMTALA, to provide care to those patients. Patients who are eligible to receive Medicaid benefits but aren't able to maintain coverage because of frequent redeterminations or work reporting requirements will also become what we call self-pay or no-pay healthcare customers. All of this results in severe impacts to the resources, funding, and access to care in emergency rooms across local communities. Over the next 10 years, our definition of a full continuum of care will start to change. The bare minimum for a community's health care in 2025 will be a victory to achieve by 2030. We are staring down a steady decline for rural health, and we have to take action before this momentum takes us too far to the no return. What can we do? Some communities are ignoring the crisis in the hope that other responsible parties will simply figure it out before we see any impact or effects. But some are taking real action. Although Medicaid is facing serious spending cuts, one of our primary concerns is the decrease in enrollment due to the reporting requirements, redetermination, and a simple lack of communication. The latest projection was 11.8 million Americans losing insurance by 2034. With this sea change on its way, some hospitals, Hillsdale included, are looking at ways to proactively engage their community in Medicaid enrollment and education about the new reporting requirements. Community health workers play a major role in this work, coming alongside families and individuals who are eligible for Medicaid but don't know how to enroll, or some have barriers preventing them from receiving these benefits. When the funding disappears and all these provisions begin posing new barriers to beneficiaries, our hope is to have our communities equipped and educated so each insured individual who is eligible can complete their enrollment, redetermination, and reporting with as many resources available to them as possible. If you want to learn more about the work Hillsdale Hospital is doing to preserve the future of rural health, visit hillsdalehospital.com/ruralhealthstrong. Finally, our success story. The Michigan Center for Rural Health released a rural health equity plan to address the disparities in Michigan's healthcare and improve access in rural communities. The goal of the plan is to identify a path to a more equitable future in healthcare with direct action steps like improving food insecurity, stabilizing access to housing, and connecting rural residents to the healthcare they need across the state of Michigan. The main barriers the report identified, including the healthcare workforce shortage and limited community transportation, two concerns every rural hospital is very familiar with. The Michigan Center for Rural Health is partnering with the Michigan Department of Health and Human Services, policy and planning offices to convene an advisory group and to return reporting and hopefully turn this report into real change. As a rural hospital in Michigan, we are grateful for the work that the Michigan Center for Rural Health is doing to help us improve access to care for our patients and our neighbors. Thank you to our sources for this episode, the Congressional Budget Office, Congress.gov, Becker's Hospital Review, Modern Healthcare, and the Michigan Center for Rural Health.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.